So for this work seated, Lauren's just sitting independently on the massage table. She's got a cushion for support just for her bump, but I'm going to be careful. I'm not pressing too hard, so I'm not going to press her off the table. The area we're working here is the sacrum. It's harder to find when somebody's sitting down, but just have a little feel around and you'll soon find those edges of the sacrum. Once you have, you're just making small circular movements right across the top of the sacrum. You can see I do it with 3 fingers together because I'm covering a bigger area there, and it feels nicer for the client than if you're just using your thumb and using a specific pressure point, or using the specific pressure from one point in your finger, that is. And it's just these repetitive circles all around the sacrum. You can move right to the edge, that's fine. You're stopping well above the start of the intergluteal cleft, so you're not going too low. You'll feel where the sacrum starts to kind of be harder to feel with your fingers. And it's just sort of small circular movements. It's quite a nice one to give, it's a nice one to receive, and it's helping to relieve that lower back pain that often comes, particularly with the later stages of pregnancy. Sometimes you will see 2 dimples here on the lady as those ligaments pull. This area is working really hard. It's supporting a baby, just as the lady is walking around doing everyday things. This is part of the support structure for keeping that bump in place. So you see, you can repeat this as many times as you want. If your fingers start to tire, you can use the flat of your knuckles, not actual knuckles themselves, but just the flat. And you can also use the heel of your hand if you want. It's harder to do that seated because I don't want to put too much pressure on Lauren, and it's more tricky to find the edges of the sacrum. So I stick to the 3 fingers together or the flat of the knuckles. And now let's see that from a side position. So now Lauren is on her left side again. Her head is supported by a pillow, and we've got the V-shaped pillow between her knees and underneath her bump, giving some nice support there. And we're just going to repeat exactly what we've done, exactly what we've just demonstrated in that seated position. So we're working, the sacrum is here. It's the edges of Lauren's sacrum. And we're doing those little circles all across the sacrum. So you're working on a bone, but it's the one place that you can very easily work across the bone. You won't do any damage there. If your fingers start to tire, just again using the flat of the knuckles. It doesn't really matter what order you're going in. You don't need to work in a particular way. You don't need to start at the top and finish at the bottom, or start on the left and finish at the right, anything like that. You can just go across the whole of the sacrum. Now, sometimes it is good to warn your ladies that sometimes, particularly in the first trimester, they might come in able to fit into their skinny jeans. But by the time you've finished doing this, sometimes the bump has often grown and the skinny jeans will no longer zip up. So it's just worth warning you ladies, don't come in kind of tight pre-pregnancy clothes if you're in your first trimester, because you might not fit into them by the time you leave an hour later.